ganglionic because you activate the whole system. In general, the sympathetic activates the whole system because you're going to run. And you don't want to stay in the sympathetic all the time. Okay, so those are one of the differences. You know the transmitters, you know that stuff. Okay, now walk into the cranial nerves. We can talk through them because you need them tomorrow, right? Mm-hmm. So you should know. Okay, what is the 4 ones that have to do with the eyes? Those are not hard. 4 of the 12, eyes. Which one do you see with? Eyes, 4. Which one do you see? Okay, and what's the number? Okay, that's 2. Okay, what happens? What's the next one? Okay, oculo. Okay, this one, this is my guess one, right? Number. And it has extrinsic, which means what? Outside muscles. And it has intrinsic. What's intrinsic?
Inside.
Like the pupil. Okay, like the pupil size and the lens focusing, those are intrinsic muscles. They're coming in on 3. They're coming to your eyeball on 3. And then it does like 4 muscles that move the eyeball. So this one is the one you guessed. There's 4 muscles that move the eyeball. So 3 is the big one. Now you have 2 more, and I always jump to number 6 next, okay? What's number 6?
Is that trochlear?
Okay, 6, what do you call a muscle that pulls sideways? It's on the lateral surface, and the muscle is a straight muscle. Okay, so this one, we know this is lateral rectus. What do you call what does the nerve do to that muscle? It causes it to your eye. It causes abduction of your eye. Adduction, ADD would be bringing it back. That would be medial rectus. But abduction, ABD, is moving it away. So the nerve is called the abducens, ABD. Okay, abduction of the eye, abducens nerve. Anyway, whatever you spell it. But this means here's your nose. You're moving it away from midline. Okay. So now we can do the 4 because by elimination, we know lateral rectus does this, medial rectus is the other one, but you have one that makes the eyeball look down and out. And it goes over a pulley, and the name for pulley is trochlear, T-R-O-C-H, trochlear nerve. Okay, the trochlear nerve goes to the superior oblique. Causes you to look down and out. So you do this, when you're reading, you use lateral rectus, medial rectus, and they're from 2 different nerves. So you can do it. Okay, so those are the 4 for the eye. This is your guess.
The medial rectus comes in the ocular bone, right?
Yes. The medial rectus, superior rectus, inferior rectus, and inferior oblique is all from oblique. Yeah, ocular motor. Yes, that's right. Okay, so now you jump to the 2 hard ones. The only 2 hard ones are 5 and 7, right? 5, 7. Okay, so
Did you say medial?
so we're talking cranial. What is a cranial nerve? Is it a peripheral? I mean, is it a peripheral nervous system or is it central nervous system? We're talking nerves, right? Those are peripheral, and cranial means they're coming off the cranium. And spinal means they're coming off the spinal. So these are just weirder because they're separate. So if you start out with the face, here's your face. Okay, here's your face here. And here's your eyeball. Okay, what happens if you hit this and it's numb? So the nerve is not working. This is a sensory nerve, right? What nerve comes out of the face that's sensory to the face?
Trigeminal.
And it's the right side of your face and the left side. You have 2 separate nerves. So if this one is numb, the sensory does not work, what problem, what nerve is involved? This cranial nerve 5 is called trigeminal. And trigeminal means that it's the sensory from the face. However, this is a weird one. 5 and 7 are weird because if I have a numb face, that's pretty sure that the trigeminal is not working. Can I smile?
No,
You can.
I can smile because smiling comes up here to your mouth. Smiling, your smiling nerve. Smiling, this is 7. And that's called the facial, which is facial expression, facial for facial expression, facial motor. So I can smile, but I have a numb face. That's why this one's weird. And so you'll see someone and they can move their face, their eyebrows and stuff like that, but they're numb. So if they're numb and you go, well, maybe I want to make sure that it's trigeminal. What's another thing you can do to look at them? Most of it's sensory, but tell them to close their jaw. What happens when they close their jaw? The mandible goes up.
Oh, that one muscle.
It's a little tiny motor that goes to the muscles of what? Mastication. And mastication means chewing. The chewing muscles are the temporalis, the masseter, and then there's a lateral and medial pterygoid. Okay, PT. Okay, so you've got these lateral medial pterygoids, and the masseter is the one that comes up, and the temporalis comes up, and so it's chewing, making your. And if this side is numb, and you try to close the mandible up, this is not working. This will work, and your mandible's going to shift. Do weird chewing. So you start with, okay, this major part of the nerve makes it numb because it's not working, and also you can't chew right because this is not chewing. So that's 5. That's trigeminal, big sensory, smaller motor. Okay, so that's 5. Got the 5 down? Okay. But what happens? So you come along and you say, well, 7 is going to make me smile. So we go back to 7. Okay, so 7. Here's your face, and if you're working okay, then you can smile. And if you're not working okay, what do you got? You got drooping. Your mouth droops, your eyelid droops, everything's drooping. You can't facial expression. So we go, okay, 7's broken. So 7 is for facial muscle, facial expression. However, if you slap it, will they hurt or you pinch it?
Yes.
Mm-hmm. Yes, because they can sense, but they can't come back out. Well, you want to be sure, so let's do a clinical test. How would we make sure it's 7?
The taste of the.
Okay, so they stick out their tongue.
2/3.
Yeah, the anterior 2/3 of the tongue for taste. And taste is a special sense. It's a special sense. It's taste. Taste is not like being pain or temperature. Because actually, if you pinch your tongue, it goes in on 5. But the taste buds go in on 7. So ignore the 5 I just talked about. Because I forgot, so anterior 2/3 for taste. So if the person is slouching on this side and they don't have any taste on this side of the tongue, it's 7. And sometimes you develop 7 nerve damage and then it will come back. Because a lot of times it's not permanent. Okay, so that's 7. So you can do 5 and 7. Those are only the really hard ones. 5 and 7.
So it's anterior sensory of the tongue?
Anterior taste.
Taste.
Not sensory. Remember, the homework was designed to say, look at the clinical test, don't memorize the clinical test. The function would be taste. It's a special sense. Okay, out the anterior 2/3. And that comes in on 7. So that would be in on 7. Most of the motor goes out to the face, that's 7 motor. So you're using taste to back it up. What are you using 5 to back up? It's like backing it up with the mandible, closing the mandible, chewing. Then you can go to the vestibular cloaca. We did that one real well. What does the vestibular part do? Vestibular is for balance and equilibrium. Cloaca is for hearing. And so if you damage the whole nerve, then you lose balance and equilibrium and hearing. If you only damage cloaca, you lose hearing. You do the vestibular nerve, you lose balance and equilibrium. So, and you have to study all the parts of the ear, and we're not going back over through that. We're going to talk about the 3 parts of the ear. But that's called vestibular cochlear. What's the number? 8. What would be an old name for it because it has to do with hearing? Auditory. They also call it acoustic. So you hear someone talk about the auditory acoustic or the acoustic, they're doing the wrong names. But because you're missing the vestibular. But it's still the same thing. Okay, now go ahead and click. Okay, what's the next one? Okay, so this is 8. What's 9? 9 is gloss, which means tongue, and then pharynx. Okay, that's pretty easy. That one, I don't know, I'm asking you, if you go, well, never mind, because you're not coming. Anyway, this is anterior 2/3 of the tongue for taste is 7, posterior 1/3 for taste is going to be glossopharyngeal. Okay, and I don't know if people actually test this. I like to know. I keep asking people to tell me what they do in clinics, and they don't tell me. Okay, so 9. So what is 10? Spent a lot of time on 10 already. Vegas. 10 is Vegas. Vagabond. Make sure you can do Roman numerals regular, and it's the major outflow for the parasympathetic, and it also has visceral from your inside. Okay, what's 11? Accessory. And I think it has to do with, because you have a lot of reflexes with your eyes, it comes out of the cranium, and some people want to throw it out and don't even count it anymore. It does come out of the cranium, but it comes out of the spinal cord low and goes up into the brain and stuff. So it's kind of a weird one. But it's connected internally because you can do reflexes. And the reflexes need these to do it. How about 12? What does hypo mean? In this case, we're talking about hypo, and glossal is...
Tongue.
Okay, we're talking about under the surface of the tongue. Okay, so you're under the surface of the tongue. Is there any taste buds there?
No.
So we're talking muscle. And we talk muscle, skeletal muscle, we're moving the tongue. So hypoglossal is one of the easiest. It's under the surface of the tongue. Okay, so you can do the cranial nerves. You can do sympathetic, you do real well on the chest, right? Okay, do not, if you would just, I'd appreciate if you wouldn't come in before, like right before 7 unless you open the door. I have a class that has their test 5:30 to 7. If they're already done, you can come in. Otherwise, just kind of wait, and then you can stay longer if you really need to stay longer.
What did you say the basal movement out there inhibit unwanted
Movement.
Basal nuclei inhibits unwanted movement. What gets destroyed in Parkinson's disease is the basal nuclei. And so they have trouble starting and stopping, but they also have tremors. So I can see the tremors, and that makes sense to me. Trying to make it easy for, they have unwanted movement, they can't stop the tremors. It's a basal ganglia. And same thing as Huntington's chorea is in the same area. Way too much dopamine, and they have terrible movement, and eventually it kills them.
My mom had